So when we look at the heart, what do we have? We have basically a muscle with four chambers. And we have valves between each two chambers, the mitral valve and the tricuspid. And these are just valves or gates that open and close as the blood passes through the heart, each chamber. The first chamber is on to the right atrials and ventricles, onto the the lungs to get oxygenated, and then to the left side and out to the body. Now, so every tissue, it's not just the heart, every tissue in your body has three components to it. So I want you to remember these three components: blood, nerve, and lymph. Blood, nerve, and lymph. The blood obviously feeds the cells. The lymph obviously cleans the cells, but the nerve moves the cells. So you see that in every tissue. But even the neurons have blood and lymph associations, because everything's a cell. All the heart is a bunch of cells forming four chambers and valves. So that's all it is. But within the heart, you've got blood flow to the cells, you have lymph flow from the cells, and then you've got a nervous system to the cells. And you can have trouble with either one of them. But the blood and the lymph always affects everything, including the nerve. So this is why, how simple this is why you always go back and work on that lymph system. Because when the lymph system's backed up in the body, it's backed up head to toe. So things like congestive heart failure, heart hypertrophy of the heart. Hypertrophy is enlargement. What enlarges? What swells things? Swelling of the spleen, swelling of the kidneys or adrenal glands. I just talked to a lady, her sister had adrenal glands full of tumors. What is this? This is the lymph system. When the lymph system backs up, you get pain and swelling. You get edema. Your ankles swell, your heart swells, your lung swells, pulmonary edema. You fill with fluids in the body's effort to hydrate itself, to buffer these acids, because remember, when acids win, you lose. And that you have to learn that. So, obviously, congestive heart failure, hypertrophy of the heart, hypertrophy of anything, enlargement. Hypertrophy means enlargement. Whenever you have pain and swelling, that's the lymph system. Get on that lymph system. Get the kidneys and adrenal glands back on. Clean the bowels. Move those lymphs. And I've got a lot of great lymphatic formulas, but you got to work on the kidneys with it. Don't use the lymphs without the kidneys, because you could hurt the kidneys trying to pull a lot of lymph into kidneys that are not filtering yet. It's like a bunch of people rushing a closed door. So not a lot of fun. That's why detoxification, there's a proper way to do it. And working on the kidneys are very key. And of course the adrenal glands control this. This is why exercise. You know, there's a lot of misunderstanding in exercise, and it doesn't fit with physiology. An example of that. You want to exercise, your adrenal glands has to kick up norepinephrine and epinephrine, which is adrenaline. Now this dilates the vascular system or the blood flow, increases heart rate, it increases, opens up bronchial tracts so you can breathe more oxygen, you can have more blood flowing, therefore more energy to muscles. At the same time though, it suppresses acetylcholine and dopamines to shut down kidney and bowel function. You can't have everything going at once. You have to redirect energy. In one of our videos we shot yesterday, I was talking about energy management. This is why fruits, when you're sick, are so much better than vegetables. Energy management. We can't be sitting there breaking down cellulose when the body needs energy to fix itself. And the same thing with protein. Hard to digest, hard to break down. That's why you use acids to break down proteins. They're too complex. Meat's very constipating. So, understanding that when you're in a relaxed state, your norepinephrine, your epinephrine back down, your acetylcholines, your dopamines go up. This then turns on the kidneys, turns on the bowels, and allows you to eliminate. You'll see this in stressful situations. When I was going back and forth to Lisbon all the time, I didn't poop well because I was so stressed out. I hate flying to begin with, and I used to fly myself, but you know, I don't like other pilots flying. It gives me the creeps. So I get stressed out, and then all the activity and the TV shows and everything, you just kind of get really stressed out with that. When I'm relaxed, everybody moves well, but it is physiology. It's how the body works, how the adrenal glands redirects energy. So when you're sick or you want to move lymph, relax. Quit trying to think you got to get out there and always work. I think the problem with man, they don't relax. I think a primate relaxes 30 to 40% out of the day. I think it was 40% Busch Gardens that said that gorillas relax. I like that. We should relax more, because it's just vital to the health and well-being, because you have activity, but then you have to have time for the elimination of the acids you created in that activity. We have a lot of pro athletes, I think I mentioned to you, that have serious acid problems where they're breaking down. They got a lot of arthritises, a lot of RA, and because they have a lot of activity, of course the high protein diets did break down their kidneys, but then they don't know how to relax either. So then they didn't eliminate these acids and they started chewing them up, particularly their joints. So animals show you that. When animals get sick, they just sit around and relax. And that's because your adrenal glands has to deal with elimination as opposed to activity here. So again, now think about the nervous system in the heart. We've talked about the two nervous systems, but let's go to the prime nervous system called the ANS, autonomic nervous system. It's the involuntary nervous system, meaning that it's going on without you consciously realizing it. You don't remember to breathe unless I suppress your autonomic nervous system. You've got to think to breathe. And I think I mentioned when I poisoned myself with quinine, I shut down my autonomic. I had to remember to breathe or I'd sit here and just pass out on you, because my autonomic nervous system was suppressed. And you'll see this in yourself. It builds anxieties, shortnesses of breath, hard to get a deep breath, and that's with all these neurotoxins. I was so sensitive I could eat a salad at a restaurant and start getting anxieties because they forgot to take the pesticides and herbicides off of these foods. And those are neurotoxins. And we talked about autism yesterday, and how you can't give neurotoxins to these infants and these young people because they're so compromised neurologically that they go right into some severe neurological problems. So it's important to understand these things that we're talking about, and real simple too. So when your nervous system is suppressed, it can create heart arrhythmias. Now, it can be suppressed in the heart itself by heavy lymph stagnation in the heart, can suppress just the nervous system of the heart. But I can tell you that the autonomic nervous system is controlled by the adrenal glands, and that you want to look to your adrenal glands when you start seeing atrial fibrillation or any problem like that. You're going to still be fixing the adrenals, increasing your nerve function. We've got a good brain and nerve formula to increase nerve performance, and you're going to be moving that lymph again, cleaning that heart. But you can't just clean the heart. Your whole body's going to clean head to toe. How beautiful is that? You can't just get one area of your body to clean itself and fix itself. The body will fix itself head to toe. Magic. I mean, I love that. And of course, blood flow. Real important to understand this one. I think it was Deepak, Dr. Wild, put an article, and I don't, forgive me if I'm wrong, but it was in the Wall Street Journal maybe, or the New York Times, talking about the fallacy of the open hearts and stents and all this, and the use of cholesterol or statin drugs. Now, there are situations where stents have helped save a lot of people, I'll tell you that right now. And it's not just stents in coronary arteries, it's stents in things like the bile duct, things like this, because we've taken our body pretty bad. But I want to reference you, and I talked about this, I think, the other day, where if you look at the commercial for Lipitor, Plavix, and Crestor, and I went over that with you to show you that if you look closely, they place the cholesterol plaquing in the artery wall, not on the artery. Crestor did a commercial initially putting cholesterol on the artery wall and then changed it because they realized someone had told them cholesterol doesn't start plaquing on the wall. Cholesterol is alkaline. You're not going to have an anionic environment in the blood unless you're high protein. Then that's when you see your blood cells start sticking, is when you vary that pH a little bit with so much protein. Now you're creating this anionic a little bit in the blood, and then all your red blood cells start attaching to each other, following each other like choo-choo trains, or clustering. That's what you don't want. That lowers iron and hemoglobin. That lowers it because you're losing that carrying capacity of each individual cell. And then the adrenal glands, of course, deals with iron utilization and deals with how the hemoglobin, I mean, there's a lot to that. Clean your spleen, too. Cholesterol is the body's main antacid. Initially, the adrenal steroids, which are made from LDL, is the body's main antacid. Medical doctors use cortisone, which is cortisol, all the time for inflamed or acid conditions, instead of removing the acids. Of course, remember we talked about if you take cortisol or steroids, you'll lose your adrenal glands. A good veterinarian will never give their animals cortisone shots because they'll lose their adrenal glands. It's the same thing with hormones. But cholesterol starts plaquing where there's acids. It's kind of like that commercial where this man and this woman inspector's walking around the dam, and she sees a little leak, and he's chewing some gum or something, and he goes, oh, okay, and he puts the gum, and he sticks the piece of gum in this leak in this big dam, and then they start to walk off, and then you see the gum pop behind them. Well, cholesterol is like that gum. It's like we have to stop acids in the body, or the acids break you down. So adrenal steroids are antacid. Cholesterol is the body's main antacid, and of course calcium. We talked about the importance of calcium. The body sucks calcium out of you to fight acids. It's this game. So then what you see is cholesterol plaquing in the wall, swelling the wall, or you see calcifications, the body pulling calcium out of structure, and then you see the crystallization or calcifications, call it stenosis, whatever you wish. But then you can get hardening of the arteries, you can get swelling of the arteries, and of course pulling out calcium can cause vascular integrity weakness, and you can have vascular collapses. Or vascular spasms. You can have strokes and heart attacks from vascular spasms, vascular collapses, vascular occlusions, which means blockages. All of these things are very curable. What do you have to do? What's causing them? Acids. Well, where do the acids come from? The cells themselves. And what system deals with acids? Your lymphatic system. And understanding that lymphatic system, you'll find we're going to always go back to there. Even in blood disorders, we're going to go back to there. You can take herbs to clean up the blood, okay, but go back to your lymphatic system always, kidney and adrenals, and clean out those lymph nodes and things. So in any heart condition, remember, don't go out and exercise. Don't go out and exercise. Not good. I remember a young man in one of these local hospitals, and he was 43 years old. He came in about 2 o'clock with a heart attack. I came in the morning in cardiopulmonary, and I was doing some time there just for the fun of it. And I saw this stat means now, EKG. I need an EKG real bad on the cardiac floor. So I was the only one there, and I ran up there, and there was an EKG machine that the cardiopulmonary leaves on these cardiac floors at night. And here's this big charge nurse sitting there, and I said, here's your EKG machine. How come you're the nurse, head nurse? How come you didn't do one on him? Because when you're on the floor in the rooms, you have a heart monitor on you, but it only monitors what they call lead 2. So you're only seeing one view of a heart. If you notice, an EKG is 12 views of the heart. So you're looking at the heart, all the different walls of the heart, because you can have an infarction or a heart attack on one side of the heart and not see it if you're looking at the other side of the heart. So that's the value of a 12 lead. When you're in generally being monitored, you're only monitored in one lead. Some monitors might monitor in more, but so I went down and we went down. I went down and did an EKG on him, and sure enough, he was having an infarction or a heart attack on one wall. He'd had pain all night long, and so I ran down and I showed the charge nurse this. Well, she freaked out, called Code Blue, and we both went running down to the to the room where he was, and I was talking with him, and we were chatting with him, and I looked at his heart monitor, went 60, 50, 40, 30, and back he went. He went right out. So I grabbed the covers and threw him off the bed and grabbed his left foot. And right there in the ball of that foot, more over to the edge here, is the heart reflex. And I started rubbing that. By the time the ER doc got there in the crash cart, I had him up talking to us. And there was a couple of cardiologists that had ran in the room and a PA, and they said, "What the hell are you doing?" And I said, "Watch this." And I got him back up and talking with us without cracking his sternum, without any meds, without any epinephrine. I got him up talking to us, and I've done that 3 times. I did it once in a restaurant, and I did it 2 times in a hospital. And that, of course, this is the nervous system to the heart that ends in your feet, and in your, you can do it in the left hand too. This is left foot, left hand right here. And you can actually stimulate the heart to start pumping again by this stimulation. And sure enough, and if you have heart pains, you want to start working on your heart reflexes. It'll help you. Here's one right in this sternum area as well, right under this chest area here, the left breast, and you'll see this right on the left side of the sternum there. And you start rubbing these areas, and you'll start turning that heart back on. So they took him to an intensive care unit, and I went back that afternoon to visit him, and he was eating a barbecued beef sandwich and French fries. Now, here is a post-MI, very sensitive, everything's inflamed, everything's very sensitive and prone to spasm, and they're having a barbecued beef and French fries. I mean, that dietitian or physician should have been sued. So I was livid, but I went back the next day. I was off, and I went back the next day, and they told me he had died that afternoon, and they couldn't get him back. Well, of course, they killed him. You know, I mean, he killed himself, but the bottom line, they just quickened the process. We could have saved him. He was only 43 years old. And this is the problem we have. So the importance of raw fruits and vegetables can't be underestimated on all these cases of emergency medicine. And what you can do in emergency medicine without hurting people, because I've cracked a lot of sternums before in the elderly doing it their way. Fruits, berries, and melons high in flavonoids, which strengthen the integrity of the vascular system. So in all heart issues, fruits, berries, and melons are still going to come up there being the highest foods possible. You're always going to move lymph, you're always going to fix the kidneys, and you're always going to work on the adrenal glands, which translates into the autonomic nerve health. And that's nerve health here. Now, the thyroid does affect heart rate. So you're definitely going to work on the thyroid and the health of the thyroid, but when you go and look and say thyroid, you also have the parathyroids, and calcium is a vital constituent to nerve health. So, and not only connective tissue, but bone. People have mitral valve prolapses or heart murmurs, have weak valves. This is calcium utilization problems, the same with connective tissue. So if you look at this, the simplicity of this is you're going after all the cells of the human body and making them healthy. Because if you wander too far from that, you're separating from that and going like medical doctors to individual symptoms, and you're getting confused because now it takes you away from the whole. You must incorporate the whole when you look at the part. You always have to do that. And when you do that, you're always successful because you always have to detoxify. That's why it's the golden key. Remember, the end result of detoxification is regeneration of tissue. And that's the ultimate goal here. I think I have been concerned about is my heart. I am currently on a water juice / smoothie fast. At night in my dreams, I have been noticing my heart to beating irregularly ever since I started the fast. I got into a car accident some time ago, and they told me my blood pressure is high for my age, which really confuses me. I am slowly getting back into exercise after my car accident, rebounding. What can I do for my heart? I should mention bad hearts are on my dad's side of the family. Now, when there's a problem with the nervous system in the heart, that creates irregular heartbeats. Now, the nervous system is also made of a bunch of cells and impacted by blood and lymph. So the lymph system or the blood system can impact the nervous system, no question about it. But also does the adrenal glands. the adrenal glands, and you had an accident, which is emotional, and that trauma could have resulted in a far greater hypofunction of the adrenal glands, the trauma from that, and therefore you saw neurological problems to the heart. The other side of this is calcium utilization problems, which is going back to parathyroid again, when you're not utilizing calcium, and calcium will also affect nerve impulses to the heart. So I would definitely check my parathyroid, work on that, get my adrenals up for neurological or heart arrhythmias. I wouldn't normally say that people that have heart arrhythmias have heart problems. You know, we jump and say we have heart problems when it could be actually a nerve problem. It could actually be a blood problem and a lymphatic problem. Congestive heart failure, that's the lymph system in the heart, and of course when the lymph system's backed up in the body, it's backed up in the heart, and of course then you have blood flow. Blood flow is impacted by the lymph system more than anything. So when you see calcifications or you see cholesterol plaquing in the coronary arteries, it's actually in the wall. This is actually the lymph system causing this. So I would get into my kidneys, into my adrenal glands, really build those up, use a new brain and nerve if you want to. We have a heart formula that's excellent for the heart. You could have a heart muscle weakness, which would be a weakness of the cells, but then blood, lymph, and nerve affect those. So getting all that healthy is going to pull you back out of that and strengthen that heart. Let's see, my friend wanted me to ask about MVP, mitral valve prolapse. Her name is Samantha, and I will be showing her this video. She has MVP and would like some suggestions as what she can do to heal it. The heart has two valves that open up and allow blood to flow from one chamber to another chamber. You have the two top atrials and the two bottom ventricles. So these valves, the tricuspid and mitral valve, are the valves between these chambers that when the electrical pulse comes, opens a valve, then your blood flows from one to the next and shoved right out into the system there. First to the lungs to get oxygenated and then out to the body to feed the cells. Whenever you see a weakness in connective tissue, valves, sphincters, which close, open, and close like the stomach, the bladder, when you see these weaknesses, the suggestion might be parathyroid. Now, it's possible that someone down in the family had so much congestion in the heart, congestive heart failure, blah, 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 that high acidosis, of course, weakened the valves. And then genetically passing that weakness, yes, that is true, and you might not have a parathyroid weakness. But out of the sake of all this, you've got to move lymph. Prime, broken record, whatever, you got to move lymph. That's the acid medium that continues to perpetuate these weaknesses. Second of all, I would pop up my parathyroid just to get calcium utilization. Then all your nails, your connective tissue, your sphincters, your valve, everybody gets stronger. So the key is the acid side of chemistry in the lymph system. That's where the problems come in when you're starting to see the breakdown of tissue, whether it's valves, like I said, sphincters, just muscle, bone, doesn't matter. Doesn't matter. So that's what you would want to look at simultaneously. Really move your lymph, clean up the bowels. Always follow that protocol, and you'll do well at the end analysis. So continue to detoxify. Tell your friend there that she's got to move lymph, and that'll correct anything that could be of a local area of acidosis that's removing acids, because that can also lead to cholesterol plaquing in the artery wall, stenosis in the artery wall, all leading to occlusions and then heart attacks. If it's just a genetic weakness in the valve, you can still strengthen it up, but you want to make sure you're moving lymph, empower the cells, empower the body, and make sure that parathyroid is up there, and you'll be okay. I was told by cardiologists that we went over this. Cardiologists should not fast because it would stress my heart. This is a lot of love. Alone a lot of. You know what? I just disagree with that totally. But however, I do like fruits and berries and melons as a form of fasting because it's balanced. It's nutritive, it's healthy, it's powerful, it's astringent, it's good for you, it enhances and cleans. So I like that better than water fasting, I do. But if you have heart problems, those are the only foods you should be having because you surely wouldn't want to do the proteins. Protein and heart trouble has always been linked. All these links have always been there. Cardiologists have always ignored them. I spent time in a lot of cardiac work, and I used to ask some of these cardiologists, why do you recommend meat eating when you know the link? They don't care. Why do they care? You're a business machine.